Hi everybody, welcome to our Facebook Live event. Today we are covering when somebody gets diagnosed, you or your loved one, with a serious illness. And I'm really grateful to have Dr. Eric Bush here today. He's the Chief Medical Officer for Hospice of the Chesapeake. So thanks so much.
Oh, great, thanks for having me here. I appreciate it.
This morning to chat.
Sure.
So as always, we welcome people to join in our discussion, questions or comments. It's a great topic to try and sort of break down and get some more information about. So the first thing I think would be helpful to sort of talk about what are some serious illnesses that people get diagnosed with, what sort of qualifies for that.
Sure. So everybody thinks of cancer, especially late stage or advanced, and I think maybe that's a way to frame it is if you hear any buzzwords from your doctor, nurse practitioner, healthcare provider with regards to end stage or advanced. So patients with cancer that have either stage 3 or 4, but also that pertains to heart failure. Again, stage 3 or 4. There's some different staging systems. So if your doctor is using terms like advanced, end stage, progressive illness, that's the time to start to have those conversations.
Okay.
And again, whether it's cancer, congestive heart failure, emphysema, dementia, or
dementia's a big one.
Exactly. Or if you've had a loved one or you yourself has had multiple hospitalizations within the last year, within the last 6 months, and it just seems like things aren't getting better, that the patient plateaus overall, but never really gets back to their prior baseline.
Okay.
That's a good time to have those conversations, again, with your physician, nurse practitioner, healthcare providers, your family, about, hey, where are things headed to at this point in time?
So getting that, I'm sure if you're sitting in an office and you get you're not sure what the results are. I'm guessing you've had tests done, you get the results. That's got to be like a whammy,
right?
To get that news. I'm wondering if there's something that folks can ask or say. I mean, I think it's helpful that you're breaking down like what the advanced terms are to know that those are the words. But is there anything that somebody could sort of follow up and ask, or
Sure.
that you think might be helpful?
Sure, and I think one of the things to think about and to ask your doctor or nurse practitioner is just being open and honest and say, what does this mean to me?
Okay.
And if I was your brother, sister, mother, father, grandmother, grandfather, what would your advice to me be at this point in time? And how can I optimize not only my quantity of life, but quality of life?
That's a good distinction to make.
Exactly.
Yeah,
exactly.
I think sometimes that gets lost.
Correct.
And to sort of make sure that you can advocate that what you want.
Right.
Might be sometimes.
Right, and to ask your doctor, your provider, what are my options for treatment at this point in time, and what are the risks versus benefits of those treatments, and where does that lie for me for where I'm at this point in time, and really try to, and if you don't understand what your doctor's saying, ask them to break it down in simple layman's terms. We don't mean it. We get so caught up in medicalese a lot of times, and so it's fine to ask your provider.
It's okay to say, hey,
oh,
wait
absolutely.
a minute, I didn't understand what you just said.
Correct.
Could you try and explain it a different way to me, or take a couple of minutes to... So most providers would not be offended by
no.
It's just part of... Okay.
Yeah,
okay.
Exactly. It's your healthcare, it's your journey. By all means, you have a right to be as informed as possible, and that conversation is really crucial, critical in determining where you go from there if you have been diagnosed with a life-limiting illness.
Do you notice some difference in generations regarding that, sort of having that conversation with a healthcare provider?
Sure.
I'm thinking personally with my in-laws wouldn't necessarily ask because they feel that the information they get from their healthcare provider is gospel or is, just the law.
Right.
And necessarily understand, they might feel intimidated
Sure.
to ask. Have you noticed
Sure.
that from a...
Oh, very, very much so.
Yeah.
So folks that are, I'd say, 70, 75 plus, a lot of times are still, you're the doctor, you decide what's best. And so especially for me, a lot of times I'm seeing patients that have been referred by another physician, another nurse practitioner. I'll just try to summarize what my understanding of their care is and where I think we should go from there. And they'll tell me, well, you're the doctor, you make the decision. And what I tell them is, and it's true, I'm really just kind of thinking out loud and want to let them know my thoughts. Whereas folks in younger generations want to be more participatory in their healthcare and want to come to that group decision. And so again, I think summarizing what you know and what your understanding is, because sometimes there's some gaps in communication there.
Right.
But there are definitely generational differences between, baby boomers, early boomers, and millennials.
Well, then I'm thinking even too, you add in the whole, Google your condition,
Right.
Like, so
Right.
that adds a whole nother element to
Right.
people come in and thinking they might be the expert with
Correct.
information
Correct.
that isn't necessarily verified.
Correct, and it's totally fine to Google. What I would suggest though is you stick to, well-vetted websites, things such as Medscape or WebMD that really have some evidential basis by them. And then the other piece to keep in mind is, even if you do and you find some solid information there, how and when that information pertains to each individual may be a little bit different, and what your doctor's take may be on where you're at in that care may be different based on his or her clinical experience.
Okay.
So there's a whole, it depends on where those different things intersect at that point in time for the patient, for the provider, and what interventions are possible.
As a physician, how do you feel about people getting a second or third opinion?
Sure.
Is that, okay?
Sure.
Is that...
Oh, that's totally, that's their right. They're
Okay.
entitled to. By all means, I think, people that want a second opinion, I think that's very reasonable. Sometimes when you get to a third or fourth opinion, unless it's someone that's super subspecialized or someone that can offer something that prior physicians haven't, I think there may be a lower yield on that. But again, by all means, somebody is absolutely entitled to that.
I want to back up a second. So
Sure.
when you get this initial diagnosis from a healthcare provider, would they necessarily tell you that it is, so you really do need to listen for these buzzwords? They're
Correct.
not going to necessarily say this is something that could be serious or life-limiting.
Correct. And so one of the classic examples being, you have a mass, or we found a mass in your lung, or a mass in your belly, in your abdomen. Say, hey doc, what does that mean? And your doctor or your nurse practitioner should be able to tell you whether these are the things that are in the differential, and if one of those things they're mentioning is cancer, you may want to say to them, hey, let's back it up a minute, give me a little more details. What is the workup for this going to entail? What are the possible treatments going to be? What other physicians or providers are you going to send me to in order to make sure that we thoroughly research this?
Okay,
So,
that makes sense.
yeah.
If you guys are just joining us today, I'm chatting with Dr. Eric Bush. He's the Chief Medical Officer here at Hospice of the Chesapeake, and we're talking about if you or a loved one has been diagnosed with a serious illness, and we started with sort of what some of those illnesses are, and then some of the questions that might be helpful if you're just starting that journey, what to ask your healthcare provider, and sort of trying to break that down a little bit. I think one of the other things that I know you and I have talked about before are healthcare decisions and trying to figure some of these things out ahead of time. My thought is if you're diagnosed with a serious illness, that sort of amps up the importance.
Exactly, the urgency.
Yes, the
Correct.
urgency of having some of those discussions. So if we were to talk about that a little bit, let's talk about, first of all, what is that? So if we're
Sure.
making advanced healthcare decisions, can you sort
Sure.
of define what that is?
Sure. So advanced directives are typically written instructions should somebody have a life-limiting illness they come in essence in two general varieties. One is a living will, where you can delineate a whole multitude of things, and another one is a healthcare agent. And a lot of people, one of the things I've seen over time is some people think that they've appointed a financial power of attorney and that encompasses everything. That does not necessarily do so. It is important to denote a financial power of attorney, but it's also at least equally, if not more important, to delineate a healthcare power of attorney or healthcare agent. And there's different ways that can come about. You can do so at the time when you're diagnosed, or at the time when you sign the paperwork, or if leave it up in the hands of the physicians. Sometimes it becomes active if two physicians feel the patient no longer has capacity for decision making. There are one of the great things about being alive in this day and age is there are a lot of great online tools. There's something called 5 Wishes, which is actually available in 27 different languages and Braille. And really what it delineates is who you want to make decisions for you, how comfortable you want to be or not, what kind of medical treatment you want, what you would like your family to know, and how you want people to treat you. It is legally binding here in Maryland. So if you complete 5 Wishes, that's great. And 5 Wishes was initially brought about by a Robert Wood Johnson Foundation, United Health. They do a lot of work with geriatrics. And the other website is something called prepareforyourcare.org, which really has a whole series of video testimonials and takes you through step by step with regards to making these difficult decisions.
So appointing a healthcare agent, I guess most people kind of assume it would be their significant other or like just natural, your child, if you're an older parent. But it doesn't have to be. Like, it doesn't have to be a blood relation or somebody that you're married to. Yeah, it doesn't have to be really. Healthcare power of attorney or healthcare agent should be the person who you feel would best serve your spirit with regards to what you would or wouldn't want done and how you would want them to navigate your healthcare. Really, who would be your best advocate for you, be most in line with what you feel is important to you philosophically. So who really understands what matters to you, what kind of care you would want, all that. Again, quality and quantity of life. Gotcha. So so you need to have these conversations to sort of to figure that out. And I'm sure it's not that easy to have those types of conversations. I know that I think you shared with me there's the Conversation Project, which is also another online resource that's helpful to, if you're not really sure how to launch into that topic, because it can be, some people are very open and okay to talk about this, but other people it's hard. It's a difficult conversation to have. And I think another great resource that's available is faith-based communities. So there's a lot of, for those people that have a challenge in discussing these things sometimes with their family, enlisting the assistance of your faith community, whether it's your imam or your rabbi or your priest, that is a great way to have those, because a lot of times they are highly involved in these discussions and see a lot of families that have faced life-limiting illness. That's another great avenue to go to. To sort of help guide that conversation. As an intermediary. Exactly. So we have the healthcare agent that you would need to sort of appoint if you can't, to speak for you if you can't regarding your healthcare decisions. Touched a little bit on advanced directives and living will, and I know those two are, sometimes people don't really understand the terminology. So if you could explain that a little bit more. So advanced directives include both living will as well as healthcare agent. So advanced directive is the package. Gotcha. Exactly. Exactly. And then living will is figuring out, you were talking about the tool of using 5 Wishes, it's sort of figuring out the type of care. What you do and don't want done, so things like artificial nutrition or not, pain management, what degree of comfort you want, and what type of interventions and what degree of interventions
you do or do not want. I would suggest that you have those discussions, with your physician prior to making those decisions, because things are not like they are on TV.
Okay.
What I tell patients and families all the time is medicine is much like the rest of life. There's pros and cons with everything we do. And while, a feeding tube may be appropriate for somebody who's 25 years old, was in a motor vehicle accident and had an acute trauma and is going to get better and needs temporary nutrition to get them better, may not be appropriate for an 85-year-old who has progressive dementia, which is unfortunately only going to get worse.
Right.
And so that's the time to ask your physician, your nurse practitioner, even sometimes, again, back to faith leader, what do you think is the appropriateness of this or not if I were to be in this condition?
So how do you have that conversation with your physician when you generally have an appointment that's 15 or 20 minutes long?
Right.
Is it like you sort of need to be informed and know specifically what kind of questions you're going to ask?
Sure. So it's a great question, and Medicare is aware of this, and a couple of years ago, actually, they came out with some reimbursement codes for having these advanced care and advanced care planning discussions.
Okay.
What I would suggest is, if you feel like the urgency is there, call your doctors and tell them, hey, I just want one session completely devoted to determining my advanced directives, my wishes.
And
That's
sort of understanding
exactly
the medical part of the decisions I need to make.
Exactly. I just want to dedicate the whole visit to that.
So we haven't mentioned the Maryland MOLST. How
Sure.
does that play into the advanced care decision-making
Sure.
process?
Sure. So it does, and definitely. So the Maryland MOLST, or the Medical Orders for Life-Sustaining Treatment, is the version that Maryland has. A lot of other states have what's called PULSE, or Physician Orders for Life-Sustaining Treatment. And again, so code status is on the front, so as well as who's the one making that decision, if it's the patient, if it's a surrogate, which surrogacy is a whole other topic that we get into some other time.
Exactly. Well, I want to back up a sec. What's code status? What does that mean?
Code status, so would you want to be resuscitated? Would you want to be ventilated? And again, so somebody who's been in acute trauma, who's in a young age, by all means, the default is to resuscitate that patient.
Right.
But somebody who's 90 and frail, that could suffer things such as, broken ribs from one chest compression, that's a different discussion to have with your physician.
Right.
But in general, that's the front side, as well as degree of oxygenation you want, if you just want nasal cannula and focus on comfort, or if you want things like BiPAP or CPAP that are reasonable at times and that are non-invasive, that patients can still get without getting intubated and ventilated.
So there's lots of choices.
There are lots of choices.
It's not just like, oh, check one box.
And that's just the front. That's just it. So then on the back, there's a whole other slew of questions with regards to blood transfusions, antibiotics, dialysis, things of that nature. And again, what you do or don't want done. And that, to me, again, is something that you really want to discuss with your physician, your provider, your nurse practitioner in detail, because for each one of those, there is a defined risk versus benefit, and that risk versus benefit changes over time.
Right.
As that
and
patient's,
I'm sure depending on your condition,
Exactly.
right? Like whatever's happening.
Right, how you're doing, and not just how you're doing medically, but how you're doing overall functionally, and where that intersects for where you are at that point in time. And so sometimes those things can change, and what may be in somebody's best benefit or wasn't somebody's best benefit 6 months ago may be different today than what it was at that point.
So it shouldn't just be a one and done. It should really sort of
Correct.
just be in conjunction with the journey.
Exactly.
And sort of checking in on the progress of
Correct.
the person. Okay.
Correct.
So if someone has their advanced care directives done, let's say they filled out the 5 wishes form, but they have not had an opportunity to do the Maryland MOLST form, but they've documented their wishes. If they have a health crisis emergency where EMT is coming in, what happens then?
Yeah, so that's why it's important to get the MOLST completed too, because you know the default is still
Resuscitation.
Still resuscitation.
Okay, so that so it really should be a priority.
Correct.
To kind of get that Maryland MOLST, if they don't want resuscitation,
Right.
like if you know there's a little flexibility there,
Right.
then
Right.
okay. So, and that's definitely something that you could schedule an appointment with your physician and
Correct.
say, okay. I think you can find the Maryland MOLST form online.
Yeah, if you Google Maryland MOLST, you can find it. There's lots of blank ones. It's 3 pages total. The last page just being a little bracelet in essence. You know, your physician could fill out for you with your name and code status on there.
Yeah.
And again, these are important conversations to have with your physicians. And while the 5 wishes is legally binding in 42 states, there's 8 states where it's not. So it's not just Maryland. Again, it's, you know, you want to make sure that those, whether it's the MOLST in Maryland or physician orders for life-sustaining treatment in other states, you want to make sure to have all your ducks in a row, so to speak,
Right.
and get all those things completed.
So have the forms completed,
Correct.
let somebody know that you have the forms
Correct.
completed, where they are.
Correct.
Yeah.
Make your wishes known to your family, make them consistently known. Make sure that everybody's on the same page so that you get the kind of care that you want and desire.
Yeah, and I think we've talked about this too. The thing that's helpful is to have these conversations before you actually need them.
Correct.
Because when you're in the health crisis and at the hospital and having to make these decisions, emotions are high.
Correct.
It's really hard to think through and kind of
Right.
jump in and do all this. So, you know, if you have
Sure.
the time and are able to, it really could
Sure,
benefit.
very much so. And so you're right, and not just from a family perspective, but a lot of times you go to the hospital and you end up seeing physicians that are physicians and nurse practitioners that have never seen you before and may not be aware of the breadth or depth of the conversations you've had previously, and just exactly what your wishes are. And so it makes it more difficult from an acute treatment perspective to give you the kind of care that you want.
So to help guide and
Exactly,
direct the care
exactly.
that you're
Correct.
wishing that you would have.
Correct.
Okay. Is that when you get to the hospital, if you've had a healthcare crisis, is that something that the asking about the MOLST forms, is that
They do.
that's part
They
of
do.
the process?
Correct.
Okay.
Correct.
So, but that's again, you're not
Right.
having
You don't
a
want
lot
to wait
of,
till that point in
you're
time.
not having a lot of time to really sit there and
Exactly.
understand all of the options.
Correct.
You're having to
Correct.
make those decisions really
Better to
quickly.
have a half-hour, 45-minute visit with your physician or nurse practitioner, you know, dedicated just to that a year before that crisis occurs,
Right.
rather than waiting for the crisis to happen
Right.
and then trying to digest all this information and the different options, you know, thrown at you within
Right.
5 minutes sometimes even less.
Yeah. I appreciate being
Sure,
here. It's
sure.
a lot
Thanks
to
for having me.
cover. It's a lot
It
to
is.
take
I know it's a lot to
in,
talk
and
about.
you know, I'm really grateful that you're
Sure,
here.
thank you.
So we're going to be taking the next Mondays in November. So the next 3 Mondays that are coming up, having time with Dr. Bush and sort of talking a little bit more about serious illness. And next week with Veterans Day, we're going to be sort of covering specific issues and treatment and sort of what happens if you're a veteran and how that sort of manifests differently for their experience with serious illness and with end of life. So I appreciate you taking the next.
Thank you.
So
Thank you.
thanks again.
Appreciate you joining us today. Thanks so
Thanks.
much, Tammy. Thank you.